Hello, so this is on Dialectical Behavior Therapy by myself, Muriel Emerson. So DBT versus CBT. Dialectical Behavior Therapy is a more specific form of CBT that relies on using mindfulness skills to regulate emotion, tolerate distress, and improve relationships. Cognitive behavioral therapy is based on the idea that our thoughts and behaviors influence our feelings. So changing the way we think about and react to situations will help us feel better. So they have diagrams below that shows DBT, the four modules, versus CBT, where our thoughts influence our feelings, which influence our behaviors, and so on. So the time frame for both, DBT is the long term, versus CBT being short term. So what is DBT? In the late 1980s, psychologist Marsha M. Linehan created DBT. Dialectical behavior therapy was developed to help treat borderline personality disorder. Now it can successfully treat many other types of diagnoses. DBT is a type of cognitive behavior therapy that emphasizes the psychosocial aspect of treatment. The core theory behind DBT is that some people are more likely to react intensely or out of the ordinary towards certain emotional situations. These emotional situations primarily exist in family, romantic, or friend relationships. The theory suggests that some individuals' arousal levels increase more quickly and intensely than the average people. DBT teaches these people with intense arousal levels how to cope with these emotional surges. DBT helps individuals learn to live with discomfort in the world and accept the way things are rather than reacting to discomfort in unhelpful ways. So, I included a couple pictures of different quotes by the person who created DBT, Marsha Linehan. So this is one of them. Radical acceptance rests on letting go of the illusion of control and a willingness to notice and accept things as they are right now without judging. The other quote I decided to use is, you can't think yourself into new ways of acting. You can only act yourself into new ways of thinking. What are the characteristics of DBT? The three main characteristics of DBT that set it apart from other forms of therapy are that it is, one, support-oriented. While utilizing DBT, someone will identify their personal strengths and build on these strengths. This action improves their self-esteem and self-image. Two, cognitive-based. As stated before, DBT is a cognitive-based therapy. Clients get help identifying thoughts and beliefs that make life harder, such as, I have to be perfect. Collaborative. DBT helps build and expand the relationship between therapists and the client. In DBT, people work out their relationship problems with the therapist and vice versa. Clients work on homework assignments, role-playing tasks, and practice coping skills. All this work is done with close collaboration between the client and the therapist. So what disorders benefit from DBT? As stated before, DBT was created to treat borderline personality disorder. With slight modification, DBT has been used to treat the following disorders as well: anxiety disorder, bipolar disorder, substance addiction, depression disorders, eating disorders, borderline personality disorder, and post-traumatic stress disorder. Techniques. In practice, DBT has evolved into an evidence-based approach that can treat many conditions. Settings where DBT is common are listed below. So group therapy, clients are taught behavioral skills in a group setting. Individual therapy with a trained professional. Here, clients' learned behavior skills are adapted to their personal life challenges. Phone coaching, clients call their therapist in between sessions to receive guidance on coping with a difficult situation. So what are the four modules of DBT? DBT is comprised of 4 modules: mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Each model focuses on select skills that help alter an individual's behavior to improve their quality of life and ensure better personal relationships. So we start off with mindfulness. Mindfulness is the essential part of all the skills taught. We observe, describe, and participate are the core mindfulness what skills. They answer the question, what do I do to practice core mindfulness skills? Non-judgmentality, one mindfulness, and effectively are how skills. They answer, how do I practice core mindfulness? So this would be like you're observing and describing your feelings. And then the how is you're doing that while you're describing your feelings, you're doing it non-judgmentally. Interpersonal effectiveness. The interpersonal effectiveness model, focuses on how clients interact with people around them in their personal relationships. The skills taught are like those taught in some assertiveness and interpersonal problem-solving classes. Skills taught include effective strategies for asking for what one needs, how to assertively say no, and learning to cope with interpersonal conflict. This model focuses on situations where the objective is to change something or to resist changes someone else is trying to make, like saying no. The skills taught are intended to maximize the chances that a person's goals in a specific situation will be met, while at the same time not damaging either the relationship or the person's self-respect. So, distress tolerance. Most approaches to mental health treatment focus on changing distressing events and circumstances. These approaches pay little attention to acceptance, finding meaning, and tolerating distress. This model emphasizes learning how to bear pain skillfully. Distress tolerance skills constitutes a natural development from mindfulness skill set. They have to do with the ability to accept in a non-evaluating and non-judgmental fashion, both oneself and the current situation. Distress tolerance behaviors are concerned with tolerating and surviving crisis and with accepting life as it is in the moment. Acceptance skills include radical acceptance, turning the mind towards acceptance, and willingness versus willfulness. And then last but not least, we have emotional regulation. Dialectical behavior therapy skills for emotional regulation include learning to properly identify and label emotions, identifying obstacles to change emotions, reducing vulnerability to emotional mind, increasing positive emotional events, increasing mindfulness to current emotions, taking opposite action, and applying distress tolerance techniques. So we have kind of a stages here of DBT. So we have pre-treatment. During the first 3 to 4 sessions with a DBT therapist, clients are working with the therapist to identify goals, learn about DBT, and to clearly define the client and therapist roles in treatment. Stage 1. This stage lasts the first 6 months of therapy but may progress longer. This stage is all about helping the client eliminate life-threatening behaviors and those behaviors that are most harmful to their quality of life. These behaviors include substance use, self-harm, extreme anger, and eating disorders. Stage 2. Most clients come to DBT with some experience with trauma. During this stage, clients work to resolve stress responses. Stage 3, clients address specific behaviors they want to change. And then stage 4, clients work to gain greater fulfillment in their lives. So this is a clip I found online of what a DBT session looks like. It actually is a 20-minute video, but I cut it down to a little over 10 because I thought there was some good stuff in here to be able to see the skills in practice when you're working with a client.
Okay. Well, thank you so much for coming to see me, Kyle. What can I help you with today?
Well, I was diagnosed with depression at 9 years old. I have had three major depressive episodes in my life after that, maybe after the age of 10 or so. And I do take an antidepressant every day. But I stopped going to therapy maybe 3 months ago because of a move, so I just need to find a new therapist. So I heard you were really good from Med Circle. So I'm really just looking to see how DBT can help me manage some of my depressive symptoms and depressive episodes.
Okay. So what types of symptoms are you still struggling with right now?
Well, it's actually pretty good right now. And it's easy not to have symptoms come up, I think, when everything in your life is pretty good. And everything in my life is pretty good right now, so that makes it easier. But there is still feelings of hopelessness and helplessness that reoccur. There's also feelings of just not being enough. Like I take a lot of pride in my job at Med Circle and what we're doing and what we're doing for people. And you know, in other parts of my life as well, I work a lot with animals and people with animals, and that has a lot of pride for me attached to it because I want to help people that way. But I still have those moments like, is this, am I doing enough? Am I making a big enough impact? Am I really helping, or am I just telling myself I'm helping? And I think that's kind of the general.
Yeah. So sometimes you still struggle with, for example, thinking whether or not you're valuable, worthwhile enough. You connect that sometimes to the work that you're doing. So obviously when you're doing great and you feel great about it, everything's awesome. But then you make a mistake or something like that, you might take it harder than the average person, perhaps.
I don't know if I take mistakes harder than the average person. We all make mistakes. So for me to make a mistake, that's okay. I always want to be putting out the best that I can do. And that's not always possible. And so when I kind of feel those times are occurring, that's hard for me. And on a more significant scale, while it hasn't happened recently, I'd say, in the last 6 months, there are times where I'm so depressed, you can't get me out of bed, I cannot function, it doesn't matter how much I'm hearing you or understanding what you're saying, it doesn't change my inability to take care of myself. Like I can't take care of myself, I don't eat or I eat too much. I mean, my life just becomes a splatter of mess, until I can finally dig out of it.
How do you usually dig out of it?
Well, I go to my therapist a lot, and then sometimes we change medications. Sometimes it's just a realization. I've had those times in my life through therapy. I have a realization. Oh my gosh, that's why. And then as soon as I know it's why, I'm like, well, now that makes sense. Now I can move on.
Right. That makes sense. Tell me a little bit about the hopelessness or helplessness that you feel sometimes.
Well, I believe that those feelings are hardwired in my brain, and I feel like I was born with that, and it sucks. Like I have Crohn's disease. I didn't come in contact with some rare bug and get Crohn's disease. I just got it. They think it was hereditary, right? And that's how I relate it to depression. It's not because I don't exercise enough, or I don't believe it's because of these reasons, or that I'm not social, or whatever it is. It's just my brain is wired differently, and its default is to be helpless and hopeless. And I have to work against the way my brain is set on the default. to not fall into that category. And so when that happens, I would have canceled today. There's no room for anything in my life when that's full.
Okay. So I think for today we're going to focus on two things. I think one is to try to manage this hopelessness, helplessness that's kind of long-standing, as you mentioned. And clearly, when you're having problems managing your activities of daily living, when you're super depressed, that certainly amplifies the hopelessness and helplessness, because that just kind of starts to percolate even more, like I can't do anything, right? So I want to focus on that a little bit, and I think the other piece I want to focus on is just developing a prevention plan, because right now you're doing great. So it's really about, okay, how do I sort of reduce my vulnerability to having another significant episode, and how do I manage it when I start to see some of those things creep in, so we can sort of make sure that we get back to the baseline that I feel more comfortable at.
Okay.
So the first thing I want to talk about is the hopelessness and helplessness aspect, because it is so long-standing, and it's something that you were saying that you always have to fight. And what have you tried so far to try to fight that? Like, you just try to tell yourself to be positive. Like, what are the things that you've tried?
In my past, I have tried overeating. I've tried exercising. I've tried sleeping. And these are all things that I was probably doing on a more subconscious level to try to mask whatever I was feeling. There even was a period where I'm like, am I grabbing that wine bottle because I want a glass of wine, or because I'm feeling this way? And that was very alarming to come to a conclusion of. Things that have been successful is therapy. Good old tell me about your father therapy, right? From a psychiatrist or a therapist. Medication has been wonderful. I don't believe I could live the life I'm living without it. And being busy is and getting enough sleep are probably the two biggest things that help me keep it at bay. Awesome. But I don't feel like I'm addressing it.
Right.
I feel like it's at bay. Right? Because we drove up here to film this today, and then we're supposed to get on a plane tomorrow morning and be gone for 40 hours. We're just constantly busy.
Yeah.
And so when you're so busy, you don't have time to be helpless and hopeless because you're busy.
Right. Exactly. So sometimes maybe that distraction is keeping it at bay, but you don't feel like you've addressed the root.
Right.
So I think one of the things about hopelessness and helplessness that people find interesting is, of course, that we are all preferably agents of our lives. Like, we want to be able to be masters of our universe to some degree. And when things feel like they're starting to slip out of control, that can come up a little bit more often than other times. As you said, sometimes things are hardwired. You feel like maybe you are prone to that. But I think it still comes from a very human need to want to be masters of our universe in some way. That you don't want to have something happen to you that you didn't foresee, and therefore don't have an action plan. And when there are challenges that come up, when you are prone to hopelessness and helplessness, that could be your first default. It's, I'm not going to be able to manage this. Sort of like a message that you tell yourself. It's not going to get better. Or here we go again. And even though cognitive behavioral therapy does work on some of the modifications of these thoughts, what I'd like to focus more on is your tolerance of those stressful moments in that time, and using that as a route to get to some of the underlying issues.
I get that.
We really can't deal with the underlying issues if we can't get to a baseline in the moment. And what I mean by that is, if you are in fight or flight, the part of your brain that actually gets activated is the primordial parts of your brain. So that's not the frontal lobe that makes good decisions and manages your emotions effectively. That's the part that's just trying to survive the moment. So we have to find a way to get you out of that fight or flight activation and bring you back to a baseline where you feel like, you know what, there's nothing wrong with this moment right now. Therefore, I don't have to activate that fight or flight. And that leaves you more room to then process the deeper issues, if that makes sense.
It does.
So with the distress tolerance, there's a couple of ways that we can work on this. One thing when you are feeling hopeless and helpless is to try to improve that moment at that very time. And so a very simple way is just to self-soothe with your 5 senses. And this just involves you taking off for each of your senses something that is pleasant for that sense. And being able to commit to using those in under 1 minute. And I think that that's a really important part of this, which is that when you are starting to have that hopelessness or helplessness well up, that there's something that you can do to self-soothe in under 1 minute. That's simple. So what are some things that you can think of, for example, that would appeal to you visually, that would make you feel calm or relaxed? What does that involve?
Something visually?
Yeah. Like for some people, they like to look at a picture.
Yeah. So I really like aquascaping.
Okay.
It's underwater garden.
Okay.
So I watch these videos. They're more than a minute though. I don't know if that would work because these videos are long. But it is very peaceful and soothing and calming to watch somebody garden underwater, essentially. But that's not less than a minute. It's not a minute. It's much more than that. So I would just say images of my dog.
Yeah. Great.
I've never thought about looking at an image to handle depression, so I don't know.
Right. Yeah. And I think it really does show, again, how simple it can be.
Yeah.
Just in that moment, just to improve your moment by looking at something that's happy.
You know what I love looking at is real estate magazines.
Yeah.
And I was looking at one last night on my coffee table, and I thought, why don't I look at this more? This is so nice. So I could do that for you.
Awesome. Yeah. I've had people tell me things like they want to look at a clothing catalog. I mean, no judgment. Whatever works for you, right? So whatever brings you that sense of peace. Let's try one more sense. Like, what about olfactory? Like things that bring you.
Okay, so I'm gonna stop it right there. I just wanted to give a sense. So she did talk about this has stress tolerance and stuff like that. So that really shows you what a DBT session could look like.
Okay.
So Last, we have why I support this approach. So first, I start off with evidence of effectiveness. DBT is a great evidence-based therapy. DBT has over 30 years of research to back its effectiveness. According to an article, Psychiatric Times, the available research suggests DBT skills training can be effective as a standalone or complementary intervention for a broad range of mental health conditions. The core of DBT assumes many individuals with personal struggles haven't learned and developed effective behaviors to deal with their situations. These skills help an individual create a meaningful balance between accepting situations and creating change strategies. DBT has proven its cross-cultural value. Several other countries have conducted randomized control trials, including Australia, Brazil, Great Britain, Spain, and Taiwan. So there's therapeutic reasons. DBT has established itself as a worthwhile evidence-based treatment, providing an opportunity for true personal change. If this therapy can help a client through their struggles and help them through their emotions, then the client can reach a better quality of life. And then personal reasons. When I was going through my own struggles, mindfulness helped me through it. Mindfulness helped me label my emotions and handle them in a healthy manner. So then I just have some of my resources here, but that is it for this video. Thank you for listening and learning with me.